For over 100 years, Stanford Radiology has been improving the health of its patients through excellence in image-based patient care, research, and education. With over 54,000 square feet of research space, our combined clinical and research facilities constitute one of the world's largest centers for imaging located on a university campus. Through our ongoing efforts to transform laboratory discoveries into innovative therapies that improve health, we are committed to providing the highest level of patient care. That commitment is at the heart of our new state-of-the-art medical imaging center in Palo Alto.
Most imaging centers in the world are designed to separate you, the patient, from the professionals that work here. Here, we created a center where the physical layout promoted interaction between the patient, the radiologist, and the technologist, under the premise that the more the communication, the better the patient care would be. So the whole center is created with that in mind. We wanted to make it easy for you to come here. That's why there's a minimum of steps or a ramp for you. That's why there's valet parking. We wanted to make the environment here beautiful, which is why we have the large plate glass areas, the atrium, the materials for the lobby. Once one gets from the reception, in terms of it being patient-friendly, you're going to move from the more public areas, which include an education center, to the private areas, which truly are private. We really respect your modesty. There are rooms for yourselves to change, to wait for your examinations, and then back out again to the lobby where, in addition to a waiting area, there's a patient education center. This is really for you. We owe it to you to give you the most current information about the tests that you're going to be undergoing here. Why we're doing an MRI, why it's better than a CT scan, what's new on the horizon to make the test even better. And so we want to let you know the things that we're doing in our laboratories, even if they're not helping you today, they may be able to help you tomorrow. And that's another function of the Education Center. Medical imaging has been revolutionary. CT scanning and MR imaging in particular have transformed medicine. So for medical imaging equipment, you as a patient do want the latest and the greatest so that there's as much information content as possible coming from your study, and the interpretation then can take advantage of it.
Stanford Radiology employs state-of-the-art MRI and CT equipment, offering physicians and their patients the most advanced diagnostic capabilities available.
To a radiologist looking at images, the better the equipment, in general, the more confidence we have in our ability to make a diagnosis. Things that are subtle may just burst out on an exam that has a greater information content. Let me get to the interpretation, because we're a little bit different than most of the imaging centers in the world, in that we have back at Stanford 40 to 50 radiologists. And these radiologists are organized by subspecialty basis, which means if you have an exam of your brain or spine, that will be interpreted by someone called a neuroradiologist. If instead you have an exam of your bone and joints, that will be interpreted by a musculoskeletal radiologist. If you have an exam of your abdomen or pelvis, that will be interpreted by an abdominal imaging specialist. That subspecialty expertise adds tremendous value to the interpretation of studies.
Collaboration with industry leaders guarantees that center technology and capabilities will always be on the leading edge of the field.
We're committed to having the latest and greatest of the hardware, but it's often the software that will determine the ultimate image quality. We have upwards of 200 people that are working every day to try to come up with an idea that will make this hardware, okay, the latest and greatest of the hardware, perform even better. And it's the software enhancements that are created by scientists in our laboratory that can have a markedly different and improved result on your imaging study. So that in coming here, you'll be able to use enhancements created by our scientists that are years ahead of what's available anywhere else. So the fact that we have commitments from leading manufacturers in the world to keep the equipment base here current, the fact that the center was designed with you in mind to promote the communication between yourself and the professionals at the center, If you consider the 200 people back at Stanford that are working every day to make exams better and better for you, and then the great subspecialty expertise that's available at Stanford, putting everything together, we think that that will make our ability to help you out on a par with anywhere in the world.